All right. So I want to look at another concept in obstetrics this morning. This is what is known as a biophysical profile. So what's a biophysical profile? Of course, bio is like life, physical is like the physical stuff, profile should be doing like your total well-being, something. I'm just giving you an idea. All right, so biophysical profile is just a prenatal test. You are trying to evaluate the fetus well-being. How is the baby doing indoors, right? That's inside the tummy. Typically, you do this in the third trimester. It combines ultrasound imaging with a non-stress test to access key indicators of fetal health. You understand? So from the ultrasound, you can get to even look at your baby. So before somebody asks, this is just the gel, right? They use for ultrasound. So you are placing this gel here because let it be slippery so that the ultrasound probe can move freely. You understand? So you are doing all ultrasound on a non-stress test, So what are the components? What makes up a biophysical profile? Of course, we are saying a profile, it contains a lot of things. So components of a biophysical profile is this. Each of the following is called as either 2 if it is normal or 0 if it is abnormal. All right. So later on, if you come and add up everything, it should give you something is between 1 to 10. Okay. So fetal breathing movement. All right. If the fetal breathing movements are normal, at least one episode of rhythmic breathing lasting more than 30 seconds in 30 minutes should be dictated on ultrasound. It is abnormal, the baby is not breathing, or less than 30 seconds of breathing, all right, will be seen in 30 minutes, which is not normal. All right. Then the gross body movement, at least when you see the baby, all right, you should be able to do at least 3 or more discrete body movement. The baby likes the amniotic fluid, so it's just moving freely. If it is abnormal, then you have like fewer than 3 movements, all right, throughout when you saw the baby in 30 minutes. Fetal tone, right? So at least, not if it is normal, at least one episode of active extension and flexion. You're looking at the muscle tone. Is the baby weak or is the baby active? You understand? Abnormal, slow extension with no return, no movement. Then the amniotic fluid volume, right? A single vertical pocket of fluid measuring. Like this one is just ways of trying to see like how the amount of amniotic fluid that the baby actually has at its predisposal. All right. Then abnormal, the largest pocket is less than 2 centimeters. All right. Normal should be more than 2 centimeters. Right. So non-stress test. All right. Normal, like reactive, 2 or more acceleration in the fetal heart rate within 20 minutes. That's when they're now trying to check out for the baby's heart rate and all of that. If it is abnormal, it's non-reactive or insufficient accelerations within 20 minutes. Okay. Interpreting scores, like after you're done scoring the baby, you give them a score of what? 2 if it is normal or 0 if it is abnormal. We stated this here. All right. There's no 1. It's either 2 or 0. So when you are done, if you add everything, it's just like the baby wrote a test. So if you are getting between 8 to 10, that means the baby is normal. It's reassuring. The baby will come out. If it is 6, it's equivocal. So you need to do further testing to know what is wrong with the baby. If it is less than 4, it's abnormal. All right. So there's some 1 or 2 issues with the baby. Okay. So doctors may order for it if the pregnancy is a high risk. If the mother has diabetes, the mother has hypertension, the mother has all those complications that come with hypertension in pregnancy. That's preeclampsia, eclampsia. The mother is urinating and the urine is whitish. That's proteinuria. The doctor will order for this test, right? All right. So the doctor will also order for it if he notices that the baby is not moving much again. All right. The doctor also order for it if the pregnancy has gone past when a mother is supposed to give birth when she's pregnant. All right. So there's a concern about fetal growth, that you also order for it if there's a concern about fetal growth or amniotic fluid levels, if it is actually adequate or not.